About 4 years ago, when I had my second child, I did various internal pelvic floor injuries with the childbirth. So I ended up with an intersusception, rectocele, and various other pelvic floor weaknesses. Yeah. And over the next few years, I got a little bit of urinary frequency and a little bit of pain. I then took a tumble down the stairs about 6 months ago and fractured my coccyx, it turned out. And within a few weeks of that intense pain receding, I started to notice that the pudendal nerve problems, the frequency, urinary frequency, had come back along with a lot of pain. So that's when I first pitched up here. So the first thing Michael did was to do an internal examination and to manipulate the joint that had got fractured and try and ease, I guess, the inflammation that was there that was, in my view, causing all of the pudendal neuralgia to come back with the urinary frequency. And over the course of a few more treatments, that seemed to really help. Certainly the coccyx pain diminished a lot over that time, and the urinary frequency has certainly improved. It's not completely gone, I don't think it ever will. It's a problem I'm probably going to have to live with, but it's greatly improved. And the pain has gone a lot as well. Good. It seemed pretty clear to me, having done the coccyx injury, that there must be some connection between that and the pudendal neuralgia. But what's surprised me throughout all of my time with my various rectal problems is that the consultants have been quite reluctant to see that there is a link between the rectal problems around the coccyx or in the rectal area and the pudendal neuralgia that I've had. They've been reluctant to accept that there could be a connection. And what Michael did, which was different, was he x-rayed me. So the first thing is we found there was a fracture and really worked on that as a way of relieving the pudendal neuralgia, and I do think that's helped a lot. Correct. I think the takeaway from me from all of this and working with Michael has been understanding just how interconnected everything is in your pelvic floor area, and that seems obvious now, and I really wish that when I first had problems during the pregnancy with my second child, that had been picked up by the physios who knew about it, who might have given me different advice, and I might not have ended up with the fairly calamitous effects in my pelvic floor that I had from that labour. But I certainly think it's something that people really need to understand when they're treating women with these kind of conditions. These are very interconnected, and you need to focus on the whole of your pelvic floor and really work hard to try and get it as strong as possible. And that's something I've really benefited from with Michael, and I feel more optimistic now about the future. And I think what would make a difference is for many of the clinical professionals who are working with women like me to listen to our stories more than they have. It makes me quite frustrated that how difficult it is to communicate that. I know I'm not alone in that. I'm not a mad patient. I haven't invented these conditions and these problems, but I've struggled really to get that understanding from a lot of clinicians. They've tended to assume that it's different, it's not connected up, and that something you do around the back won't be affecting what's going on around the front. I know it is, and I think if people could listen to that and understand it, they'd give a much better service to their patients than they currently do. These conditions that I'm left with, the intersusception and so on, they affect me every single day. Every day I have problems with my bowels, without wanting to go into too much detail, and I have some problems with my bladder. It's something that is always going to be with me, and it's always going to be part of me just getting on with life. And it's been really, really hard at times. I felt very, very low. And I think the understanding of health professionals of that and a real getting their head around what this means to live with this and to understand, therefore, how to help a woman live through it would make all the difference, I think, to my quality of life and to the other women who live with this, maybe don't feel they can come forward and get help for it. What really triggered off this particular bout of pudendal neuralgia, the urinary frequency and the pain, ironically, was a visit to my colorectal surgeon who wanted to operate to repair the intersusception, which is an operation round the back, round the coccyx area. And this was about 6 weeks after I'd had the fall and done the injury, but at that point we didn't know it was a break. He gave me a very rigorous internal examination, that's what they do, but one of my key questions to him had been, will I risk making my pudendal neuralgia worse? If I have the operation, will I potentially have more problems with the urinary frequency and the pain? And he was absolutely adamant that there was no way that the operation that he was doing would have any impact on the pudendal nerve at all. It wouldn't make any difference at all. He had no record of that happening. And he gave me this internal examination and said, no, you can have this operation. You can be very confident it won't make those problems worse. The very next morning, the problem started with the real pain and the pudendal neuralgia symptoms of urinary frequency. It was as quick as that. It could have been a coincidence, but it really doesn't strike me as one. This was the rectal examination when I had an inflamed coccyx, I'm sure had triggered that off. But the consultant at the time was quite clear in his mind there couldn't be any connection. And for me, that really sums up the problem of clinicians not understanding that connection.